While parts of the medical community are on the hunt for a vaccine against the coronavirus, others are on the hunt for its origin. While the first confirmed case was in China, the exact steps of the virus's early progression are still unknown. The current working theory is that the virus originated in Wuhan, but there's still more to learn. Sequencing the virus's genome is key for the ongoing medical forensic investigation, and scientists hope by pinpointing where the virus came from and how it jumped to humans, they'll be able to develop the tools to fight the future evolution of COVID-19. It's a bit like a medical detective story. Following the clues should eventually lead us to the origin of the coronavirus that has brought us a year the world will never forget. But to get to the beginning, we'll have to work backwards.
Autumn has brought two things with it this year in Europe: falling temperatures and skyrocketing rates of coronavirus infections. Cold weather forced people inside after socializing outdoors during the summer. With many tired of adhering to strict COVID-19 precautions, infection rates are rising dramatically in Germany. Spain has been in a state of emergency since the end of October. On September 28th, 33 million people had been infected with COVID-19 around the world. On that same date, we passed the milestone of 1 million deaths. Meanwhile, life in China, where COVID-19 was first detected, is mostly back to normal, with some health restrictions in place. But after strict lockdowns across the country, people here are once again able to go to concerts. New Zealand declared itself coronavirus-free on June 8th and has only seen a handful of cases since, even allowing travel and hosting large events again. At this time, there had been nearly 7.2 million cases worldwide. Europe's first taste of the pandemic came in February. Italy bore the brunt of COVID-19 then and was quickly forced into lockdowns. Deaths and cases piled up in hospitals in the northern part of the country, prompting border closures around the EU. On February 21st, there were only 78,205 cases around the world. Researchers believe the spark that first ignited the coronavirus pandemic took hold in China. Medical forensics is a big part of the equation now. Dozens of people connected to a wet market reported flu-like symptoms in the early part of last December. The leading theory is that a man originally contracted the virus from a bat. The WHO is currently working to trace the virus's path to better understand how the pandemic could continue to spread.
Now, many scientific minds have been putting their effort into retracing the steps of this coronavirus. One of them is Dr. Peter Forster from the University of Cambridge. He joins us on the show. Thank you very much for coming along. Your research traced the genetics of the coronavirus backwards, right? A bit like you might be able to do with a person or a species, I suppose. What were you able to conclude by doing that?
Well, we gathered data from the beginning of the first samples in December 2019 up to the end of February 2020. And then we constructed it's like a complex tree, so a combination of trees to find out how the virus had developed. And we identified three early types, which we called A, B, and C. And comparing these types with the bat coronavirus, we saw that the A type was the most ancient, and B was a bit younger, and C was the most recent.
Right, so we have these three phases of the coronavirus. Where do we find those around the world? Are they everywhere?
Well, the A, B, C types are all represented in China and in East Asia, but we see early A types even penetrating to Europe, Australia, and North America. And then later, the B type takes over. So that happens in March and April. So it has developed by mutation a more infectious type, which has then taken over the world in the course of March and April. So we saw that coming up in February and March in our data.
So if we have all three of these types in China, as you say. Does that mean we can pinpoint China as the origin of this coronavirus?
I have no reason to doubt that on the basis of our analysis. But the origin question really breaks down into three questions. So the earliest origin would be the jump from between species. So, for example, from bat to human. And we did some calculations to find out when that might have happened. And interestingly, the common ancestor between the bat that we have and the human coronavirus is on the order of 5 decades. So that might mean that the coronavirus has been circulating in some part of mankind undiscovered for decades, just like the AIDS virus was not discovered until the 1980s, even though there were samples in the 50s now that we know about. Or the other solution to this conundrum is that we simply don't have the right bat yet, and there is some other bat out there which is 99.99% similar to us, and we just haven't found it yet. So anyway, the first infection from bat to humans could have happened, last year. It could have happened 50 years ago. We just don't know that yet. The next origin, number 2, is when the coronavirus started successfully spreading amongst humans. And that we have dated with some certainty. So we think that was between mid-September and early December 2019. And the third origin then
sorry, if I could just interrupt you on that one. So that's quite a bit before we have the first case towards the end of December, which was in Wuhan. How does the fact that it was spreading between people before then impact the sort of working theory that it originated in Wuhan?
Let me correct you slightly there. You said end of December is the first case. Many scientists make that mistake as well. In fact, the first genome was submitted on Christmas Eve, 24th of December. That is correct. But the first patients described with the coronavirus symptoms in a medical journal, in the Lancet, in fact, fell ill on the 1st of December. So inevitably, that patient must have caught it in November. And as for the origins of, or the theory that the origins of the infection started in the Wuhan fish market, I think is problematic for 2 reasons. First of all, as I said, the most ancient viral subtype is the A type. But what we found is that the dominant type in Wuhan, even in the early phase, in the first 3 weeks, was the B type. 20 out of 23 patients in Wuhan until mid-January have the B type, only 3 of the A type. And elsewhere in China, you find more of these A types. For example, in Yunnan or in Guangdong in southern China, where indeed you have bat populations, whereas in Wuhan you don't. So I think there are better candidates than Wuhan for the beginning of the epidemic.
That's still an awful lot of unknowns.
Yes, well, the other point which is known is that if you look at the Lancet paper from January, it actually says that the very first patient who fell ill on the 1st December had no contact with the Wuhan fish market. So this looks to me as if the fish market may have been an accelerator, a catalyst, but not necessarily the origin there.
Well, Dr. Peter Foster from the University of Cambridge, thanks for bringing us your theory and your research.
My pleasure.
Now it's the part of the programme where you get to ask the questions. You've been submitting them through our YouTube channel. So let's put one of them to our science correspondent, Derek Williams.
What will the different vaccines cost, and how does that compare to other health-related costs in the pandemic?
With reports a couple of days ago that a trial involving a vaccine developed by a team at Oxford University and pharma company AstraZeneca had returned safe and effective results. It was the third candidate to do that in the last few weeks. It's time, I think, to start talking about the next big step in overcoming the pandemic, which is the logistics of vaccinating the world. And that's going to be not only a gargantuan feat, it's going to be staggeringly expensive as well. But even so, a lot less expensive than what we're facing now. The health-related monetary costs of this pandemic so far have been just immense. One recent study that I read said they could hit $16 trillion in the US alone. And that's assuming, by the way, that SARS-CoV-2 is contained by next fall. Vaccines will be key to that containment. And compared to the cost of treatment in an ICU unit or expensive high-tech therapies like monoclonal antibodies, they'll be a bargain. The Oxford vaccine, which AstraZeneca has promised to offer at cost for the duration of the pandemic and beyond that for low-income countries, the company says it'll be charging only around $3 a dose or less for it. Since you need 2 of them, that works out to about $6 per vaccination. The other 2 vaccines currently ramping up are more expensive, but still come in at under $25 a dose. Distribution costs will, of course, add a lot to the overall total, but effective vaccines are still orders of magnitude cheaper than hospitalizing possibly millions more people and continued lockdowns.